Welcome to our webinar, Introduction to Our Services. What should you look for in a billing service? Prompt claim submissions? We guarantee that claims are submitted by the next business day at the latest. Accurate claim submissions. Communication, communication, communication. You want billing services that communicate with you. You want a billing service that has knowledge of your practice specialty, that has reasonable fees. Here are the specialties that we serve: behavioral health, chiropractic, physical therapy, family practice, geriatrics, and pediatrics. Now, not all practices require the same level of service with medical billing professionals. Providers should only pay for those services that they need. Therefore, we offer three different levels of service: Platinum, Premium Plus, and Premium. For the Platinum service, it will include prompt claim submission, posting all insurance payments and patient payments in our Metasoft software. For Therapy Notes users, we can submit claims and post all payments in Therapy Notes. We will verify insurance eligibility and benefits for any new patients or for patients who change insurance. We will follow up outstanding claims and claims that deny an error. We will track authorizations and referrals, and we can provide you a detailed claim submission report. For the Premium Plus service, it includes the prompt claim submission, posting all payments, the detailed claim submission report, and we provide a detailed primary insurance aging report showing open claims that were submitted at least 30 days ago. Verification of benefits is optional, $7.95 per verification. Authorization tracking is optional for $29.95 per month. And follow-up of outstanding or denied claims is not available. Under the Premium Plus service, your office follows up on any claims that deny in error or remain outstanding after 30 days. For the Premium service, it includes prompt claim submission and a detailed claim submission report. Verification of benefits is optional. Authorization tracking is also optional. This level of service is designed for practices that are out of network with all payers. Therefore, insurance payment posting is not included and follow-up of outstanding or denied claims is not available. This is a sample primary claim submission report that will be provided immediately after we submit claims in Metasoft. This is a sample primary insurance aging report that will be provided to providers under the Premium Plus service, broken down by payer, by patient, by claim, so you can easily follow up. For the Platinum service, the standard rate is $3.99 per claim with a minimum fee of $199.95 per month. If you submit 20 or more claims per week on average, a 1,000 claim prepayment option is $3.65 per claim. If you submit 40 or more claims per week on average, a 2,000 claim prepayment option is $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. There is a one-time setup fee of $99.95. For the Premium Plus service, the standard rate is $2.89 per claim, with a minimum fee of $99.95 per month. For 1,000 claim, annual prepayment option is $2.59 per claim. If you submit 50 or more claims per week on average, a 2,500 claim prepayment option is $2.19 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year. And again, the one-time setup fee of $99.95 applies. For the Premium service, the standard rate is $2.45 per claim, with a minimum fee of $69.95 per month. A 1,000 claim prepayment option is $2.15 per claim. A 2,500 claim prepayment option is $1.75 per claim. Again, the number of claims purchased must be used within 1 year, and there is a one-time setup fee of $99.95. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. So if you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum service standard rate. If your average reimbursement per visit is more than $80, your savings by using MBPros is even greater. For example, If your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging a percentage compared to a maximum of $3.99 per claim with MBPros. If you group visits together by patient, you can save. If you are using our online billing form to submit billing, let's take an example where you submit on April 15th 2 visits for John Smith for April 1st and April 8th, and those 2 visits are grouped together on our billing form. Let's also assume you are reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits. If you are enrolled for our Platinum service, you would pay a maximum of $3.99 for that claim, assuming there's a maximum of 6 lines on that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid. In reality, follow-up is needed on only 2 to 5% of claims depending upon your specialty. If you submit 100 claims during the month, you would be overpaying on the 95 to 98 claims that are processed without any need for follow-up. And you can visit mbpros.com/save to calculate how much you can save by switching to MBPros. So, how do you submit billing to us? Most practices submit patient information and billing via our secure online forms on our website. For providers using one of our preferred EHR partners, we can obtain patient demographics and billing from the EHR. Now, for providers using Therapy Notes, you should watch our on-demand webinar, Need Help Billing in Therapy Notes? In that webinar, we explain our services with billing inside of Therapy Notes. For providers using any other EHR, most programs will allow you to print a report of patient demographics and print a billing report providing us the required information. Now, we do have an introductory special. If you're registered for our Premium Plus or Platinum service, you receive 1 month free with our standard per claim rate with a limit of 100 free claims per month. Note that the 1 month free is for the 3rd month of service. It is not for the 1st month. So for the first 2 months, the standard rate does apply. Month 3 is free with a limit of 100 free claims. You also save 10% off our standard rate for the first year. You would pay only $261 per claim. For the Premium Plus service, you would pay only $359 per claim. For the Platinum service, for smaller practices, you save 10% off our minimum monthly fees. So for the Platinum service, the minimum fee is $179.95 per month for the first year, not counting that 3rd month that is free. For the Premium Plus service, the minimum fee will be $89.95 per month for the first year. If you want to prepay and save, you will purchase a prepayment option and receive 2 months free, and it will be months 3 and 4. Again, it's not the first 2 months free, it's months 3 and 4 with a limit of 100 free claims per month, and you save 20% for all prepayment purchases during the first year. So for the Premium Plus service, you purchase 1,000 claims for only $207 per claim. You can also purchase a 2,500 claim prepayment for $1.75 per claim. If you choose our full service, Platinum service, that's similar to a billing service charging a percentage. You purchase 1,000 claims for only $292 per claim. You purchase 2,000 claims for only $268 per claim. Normally, you have to use the number of claims purchased within 1 year. For the introductory offer, you actually will have 14 months within which to use the number of claims purchased since you received the 2 months free. So the 12 months and 2 months will be 14 months. Any renewals after that time period, you have to use the number of claims purchased within 1 year. Our setup fee of $99.95 is waived for providers purchasing a prepayment option. The setup fee does apply if you register for our standard rate. Now, assuming you're not using Therapy Notes, we will be submitting claims via the ClaimMD clearinghouse. We provide you the opportunity to access the ClaimMD portal to view all claims submitted by MBPros with the status of those claims. You can view ERA files, electronic EOBs. When searching for a claim, if the claim was paid by ERA, you will see the corresponding payment for that claim. You also can run eligibility and benefit requests for your patient. ClaimMD will bill you directly for the plan that you choose. Providers can choose from 3 options: unlimited, small volume, or basic. For detailed ClaimMD pricing, you can visit claim.md/pricing. As a little background, for unlimited, it's $100 per month. For small volume, it's $50 per month for up to 100 transactions. For basic, it's $25 per month plus 30 cents per transaction. If you're enrolled for the Premium or Premium Plus service, you can choose the no portal access. If you do not need access to claims and ERAs, Platinum service providers must choose one of the paid plans, since you must know what EOBs we're getting electronically so you can send us the other ones. To help providers, though, we provide you a credit of $20 per month on your monthly invoice from us if you choose the unlimited option, or $10 a month on your monthly invoice if you choose the small volume or basic option. So for example, if you choose the small volume option, you pay ClaimMD $50 per month, but you will see a credit of $10 per month on your invoice with us. If you choose unlimited, you'll pay ClaimMD $100, but you will see a $20 per month credit on your invoice with us. That does conclude this webinar. You can go and visit us at mbpros.com. You can email us at info@mbpros.com. Call us at 877-762-7767. We strongly encourage you to visit the references page on our website to see more than 40 references nationwide you can contact. Most of them have written testimonials you can read. Also, there is no long-term contract to sign. Unlike most billing services that require you to sign a year or 2-year contract, we are month to month. You will switch to us and save. Finally, if you want to meet with us virtually because you have questions, you want to meet in a pressure-free environment, one-on-one, you can schedule your meeting by going to mbpros.com/virtual. Thank you for attending this on-demand webinar.